Hi everyone, thanks for joining me again. I'm Jody Emery, your licensed acupuncturist at Gershon Pain Specialist. Today I want to talk to you about your first acupuncture treatment. Some things to expect, how the actual treatment is going to go. We're going to talk about the acupuncture needles, and then we're going to do a quick little demonstration so you can see a little bit more about what to expect with your first treatment. So your first treatment, I usually tell people to expect to spend about 75 to 90 minutes with myself. That'll include the actual treatment, but when you come in, we're going to talk about what your main concern is, as well as a lot of other areas of your health. And what this is going to do is it's going to give me a better idea of how I can help you feel better. So if you're coming in for pain, we're going to talk about your pain, obviously, but we're going to talk about your sleep, your energy, your digestive system, and any other areas of your health that you feel you could use an improvement upon. So we're going to do that, and that's going to help guide me through your treatment. Another thing that we're going to do is I may ask to see your tongue, and I may take your pulse. Now, tongue and pulse diagnosis is really important in Chinese medicine, and that is ultimately how I diagnose and how I know to treat you. I do have a couple of pictures posted on my Facebook page that show different tongues with a little bit of an explanation behind what those tongues mean. When I look at your tongue, I'm looking at the color of it, the size of it, the shape of it, and the coating of it. And all those things tell me something different. Next, I'm going to take your pulse. And I take the radial pulse on both your right and your left wrist. I'm not counting beats per minute, but I am getting a sense of how fast or how slow it is, if it's really deep or if it's pretty superficial, if it feels really thin like a thread, or if it feels really big like a rope. That, in combination with the tongue and what we talk about in your intake, ultimately lead me to what acupoints are going to be needled and how to best take care of you and help you to feel better. Now, the next thing I want to do is talk about prior to your treatment, so things to do. First of all, just wear comfortable clothing. We'll get set up during the treatment itself, so don't be too concerned about that. Make sure that you've had something to eat within the last couple of hours. And I also tell people, especially for their first treatment, try to plan it at a time when you don't have a lot of things to do following the treatment. A lot of people tend to get pretty tired or feel a little worn out after their first treatment, and that's really normal. So just don't plan a lot of things following your first treatment, if at all possible. Now, the treatment itself, what I really want to talk about are the acupuncture needles. A lot of people are afraid of needles, they've got a fear of it, but what I always tell everyone is that acupuncture needles are not used to other needles that when you're getting shots or you're getting injections or anything else. So I want to talk about the size of the acupuncture needles now. Now, the first thing I'm going to show you is this. This is an 18 gauge needle. It's 1.2 millimeters. I have inside of it, inside the actual needle, 13 acupuncture needles. That's how much smaller acupuncture needles are than a needle if you were to get an IV. Like I said, this is an 18 gauge needle. Next thing is I've got a sewing needle. Now, this is about 1 millimeter, so a little bit smaller than that, but still quite a bit bigger than an acupuncture needle. Going down to a 25 gauge needle, which is about 0.5 millimeters in diameter. Now, this is an acupuncture needle. This is a 30 gauge needle, which is one of the more common sizes to use. It's 0.2 millimeters. So much, much smaller than even a pretty small injection needle. There's nothing coated on the acupuncture needles. There's no medicine or herb or anything on the actual needle, and they're solid, so I'm not injecting you with anything either. It's purely where the needles are placed in the body to stimulate healing processes, working with different hormone levels, and really to get you feeling your best. So those are the needles. Now, the needles, the acupuncture needles, come in these pre-sterilized packages. They're used on you, removed, and then put in a sharps disposal container, so they're not reused on anyone. Within these packages, there's what we call a guide tube. So that's actually how I insert the needle, is the needle is placed in the guide tube, and then it's put on the skin and just quickly tapped through. So the acupuncture needles come in different sizes, to some that are about half the size of this, some that are a little bit longer. It depends on what muscle I'm going into and what we're trying to do with the needles, but large part is the location of the needles for that. Now here, so for the actual treatment, we've got Savannah here again. Now, Savannah did cupping last week, and this week she gets acupuncture. I've got just a couple of needles in Savannah's low back. So you can see the distance, how far they're going in. We can do them straight up and down. We can angle them in. It really depends on the location that they're in. Now before she's needled, the area is swabbed just with an alcohol swab to clean the area. Then we're going to use our pre-sterilized package needles here, and we're going to put a couple more in Savannah here so that you can see the actual insertion of an acupuncture needle. So there's the guide tube. I've got the needle in it already, and we're just going to tap it in there and then get it to the proper distance there. So you can see that we've angled that one in. And if we're doing anything else, we're doing a straight up and down. It's the same thing. Now, that's basically it. So we use needles throughout different areas of the body. If I was really working on a low back, I would probably have some acupuncture needles, maybe up by the head, the hands, down by the feet as well. So it really depends on what conditions you have, and then as well as your tongue and pulse to ultimately determine where I place the acupuncture needles. Once they're in place, they stay in place on average about 20 to 30 minutes. During that time, I've got a heat lamp. We can keep the area nice and warm. I usually dim the lights down, and then I typically step out of the room. I come back in after a couple of minutes to make sure that you're completely calm and that you're still feeling well. But once the needles are in place, that's really the whole treatment. Is we're going to let the needles do the hard work. I get them in the correct locations, and then we need to give your body time to adjust to the needles, and for the needles and the acupoints to do what they need to do. During the actual treatment, a lot of people fall asleep. It is very, very relaxing. Make sure that you're completely comfortable with the needles, and then you can come in and take your little nap in the afternoon if you need to. Once the needles are removed, you're ready to go. I'm going to remove these on Savannah. Following your acupuncture treatment, there's not too many things that you need to be concerned about. The biggest thing is that if we're doing kind of like the cups, we're basically exposing the skin a little bit, so keep the area covered. If we're working with tight muscles, it's going to be more important to help keep that area warm. You can follow it up with some stretches or something else afterwards, but rest is really a big, important issue following an acupuncture treatment. I stated that a lot of people do feel tired after their treatments, so you may want to make sure that you don't have too much to do after your treatment and just get the proper rest. Our bodies are more efficient at rest, and that's really where the healing can continue to occur following the treatment. So we've got those removed on Savannah. She did pretty well for her first little acupuncture treatment here. So that's the basis of what an acupuncture treatment is, what to expect before, during, and following your treatment. Thanks again for tuning into this. Like I said, I've got a couple of things on the website regarding the size of the needles, the tongue, and the pulse. Look forward to hearing any questions that you may have, and you can always check me out on Facebook or at GershonPain.com, or call the office to schedule your first acupuncture treatment. Thanks again. This is Jody Emery, your licensed acupuncturist.